Hello, my name is Dr. Monica Gaur. I'm consultant radiologist and fetal medicine specialist. Ultrasound of uterus and ovaries. Now the basic, we'll start with the basic part. I have tried to keep it as simple as possible because this is something which you are going to use in your daily life. If you are doing somewhere around 20 to 25 ultrasound, out of which it is 15 to 16 ultrasound of female pelvis. So something like with more than 50% of the cases will show the abnormalities which we are going to discuss today in the uterus or in the ovaries. This is how we do the transabdominal sonography. We put the probe in the pubic area, and the first organ which is closer to the transducer is the urinary bladder. Just behind the urinary bladder, we have uterus, which is in continuation with the cervix and the vagina. Just putting the probe, we are displacing the intestinal part away. And what comes in contact is the first organ is urinary bladder, then uterus, and the cervix and the vagina in continuation with the length of the uterus. This is how we put the probe when we try to scan transabdominally and in transverse section. So this is transverse section. We are putting the probe transversely just above the pubic area. We see the urinary bladder in view because it is in closest contact with the probe. And just behind the urinary bladder, we have uterus. Okay, so this is how normal uterus looks like in transvaginal scan. This is myometrium, endometrial cavity, and now look at the probe over here. Look at the range over here. Look at the probe position over here. Now this is something which is easily telling you that yes, it is not the convex probe used here. It is nothing but the transvaginal probe used over here. So sometimes when a patient is referred to you, sending the images, nothing is written in the report, and you yourself have to judge that the scan is done transvaginally or transabdominally. So yes, of course, you can see at the anterior part of the screen and judge it that whether it is transabdominal or transvaginal. Coming to the layers of the uterus. We have three layers which have to be differentiated every time whenever you are doing a abdominal or transvaginal scan of the pelvis. The first layer is the mucosa, which is the innermost, nothing but the endometrium. It varies in thickness depending upon the stage of the menstrual cycle. So we'll talk about it again with the more slides. Another layer is muscularis layer, which is nothing but the myometrium, which is the thickest most. It's a smooth muscle layer, and it is in continuation with the fallopian tubes and on the upper side and the vagina on the lower side. The third one is perimetrium, which is serosa. Very, very, very hard to visualize because it is nothing but the very thin covering of the organ. It is a perimetrium which covers the uterus, very thin kind of layering. So yes, it is visible, but not always. So I hope you all understand that this is a transabdominal scan. It is the urinary bladder in view, which is located anterior most, and just behind the urinary bladder, we have uterus in view. Body of the uterus, cervix, and the vagina. In the center of the uterus, we can see the endometrium. The other part is myometrium, and the third one is perimetrium. Perimetrium is very difficult to visualize, of course, which I told you, because it's a thin layer which covers the uterus. Look here in this image, vagina is coming here, fundus is up somehow, and this the relationship between the vagina and the cervix is up, whereas the fundus is looking down. So the version is of course anterior, but flexion is posterior. So this is anteverted but retroflexed uterus. Here the fundus is looking down to the posterior part, but version remains the same because the angle between the vagina and the cervix is facing up. Now size of the ovaries. Pre-menopausal varies depending upon the ovulatory stage, of course. this is the size. We give the 3 size. We take 2 dimensions. We take longitudinal scan. We take this thing transfer scan. We take 3 measurements and into 0.523. So length, breadth, width into 0.523. This is something. This is the formula which I am giving you. Otherwise, normally it is generally calculated by the machine itself. You just take the measurements, 3 of them. Machine itself calculates and give you the volume. And the volume can be 1.2 to 9.0 cc, post-menopausal 1 to 3 cc. Now coming to the imperforate hymen. What happens in a perforate hymen? The area, the membrane that does not rupture, and the blood, it gets collected in the vaginal cavity or the uterine cavity. If it is located only till the vagina, it is hematocolpus. Uterus is seen very nicely, endometrium is seen very nicely. Another case when it is collected in the vagina and the uterine cavity as well. So this is hematometracolpus. Hematometracolpus. The girl somewhere around 13 to 14 years will come to you that the parents will tell you that she is 14 but still menstruation cycle have not yet started. And as soon as you put the probe, you will see such kind of picture to label it as imperforate hymen. Now, another entity which we talked about, the absence of the uterus. So what we see a line with the hyperechoic line within. This is nothing but the vagina. This is bladder, and this whole dome, hyperechoic dome-like area, which is nothing but the bowel loop. So cervix as well as uterus were not visualized in this case. This is my case. She was a girl of 15 years. She was not menstruating at all. Parents were quite tensed about it. They came, and as soon as they land up to us,